Good evening. I'd like to welcome everyone to tonight's MSIG webinar, Introduction to Competitive Video Gaming and Approach to the Esports Athlete. I'm so glad that AMSSM MSIG is hosting this webinar so AMSSM resident and medical student members can learn about all the aspects of esports and the athlete competing in this sport. I want to express my gratitude to our speakers for spending the time this evening to share their expertise with us, and we're honored to have the following AMSSM members serving as tonight's speakers: Dr. Namita Bhardwaj, Dr. Kenneth-Nwosa, and Dr. Dominic King. My name is Milan Patel, and I will be serving as the moderator for tonight's webinar. I am one of the AMSSM MSIG officers for this year, as one of the MS2 at large members, and I'm a third-year medical student at the Touro College of Osteopathic Medicine in Middletown, New York. After our speakers have finished their presentations, I will serve as the moderator for the question and answer segment. During this webinar, please enter any questions you have in the chat, and during the Q&A, I'll also ask each question entered in the chat and ask our speakers to respond to each question. And now I'd like to introduce our first speaker, Dr. Namita Bhardwaj. Dr. Namita Bhardwaj is a native Houstonian. She completed her undergraduate studies at the University of Texas at Austin, where she completed her undergraduate coursework in biology and earned her Bachelor's of Science and Bachelor's of Arts. She went on to attend Ross University to complete her medical education and to earn her Doctor of Medicine. Dr. Bhardwaj completed her family medicine residency at the University of Texas Health Center, UT Health in Houston, Texas, where she served as the chief resident in her final year of training. Dr. Bhardwaj then went on to pursue her fellowship training in primary care sports medicine at Texas Tech Health Sciences Center in El Paso. Currently, she is an associate professor in the Department of Family Medicine and Department of Orthopedic Surgery and Rehabilitation at the University of Texas Medical Branch in Galveston, Texas. During her 7-year tenure at UTMB, thus far, she has successfully mentored 13 residents to become primary care sports medicine physicians. And now I'd like to welcome Dr. Bhardwaj to please begin her presentation.
Yeah. Thank you so much, Milan, for that wonderful introduction. And I want to say good evening to everyone. And I want to say welcome and thank you so much for this opportunity for myself and my fellow panelists to talk to you about esports. So I got tasked with, hey, I get to do an introduction to esports, and then we'll have some great topics to follow as well. So I want to kind of, let's say I know it's Monday. Let's go back to the weekend. We're not going to do Halloween because we're not doing parties right now, but you're going to go enjoy an outing with your friends. You're going to your favorite or sports arena and you see these fellow fans in front of you. As you walk through the halls, you see different athletes, you see their banners, you see their player numbers, their last names as you keep going down. And then you get to your seats, and this is what you see. So, packed house, see a lot of the computer screens in the background. Again, different view set from the floor. And then this is the cheering that you will see. So just to kind of give you perspective, this is not your typical basketball game that we're looking at or your typical football game. This is actually an esports game that I actually had the privilege of going to pre-COVID. So pretty much COVID, everything was shut down soon after I went to this. And so, but you can see this was my real time, first time experience going to an esports game and experiencing the Houston Outlaws are actually now a defunct team. They retired in 2023, but this was the footage that I took to experience what is esports like going from there. So this the Houston Outlaws played were an Overwatch team, which is a real, I am blanking on the name, I'm sorry, it is I have it on a subsequent slide. We will get back to that one. We'll get back to that one, but it's a first-hand shooter game, and so that's what we were watching, and it's kind of fun to watch them how they did it and how they played. So going into esports, so how is esports defined? So I decided to look it up in the dictionary and said Merriam-Webster defines esports specifically as a multiplayer video game used as the basis for an organized competition. So we're gonna time travel a little bit. So not now, first we went back to the weekend. Now we're going to go time travel back all the way to 1972. So 1972, that is before I was born and probably most of the people who are on this call. But Watergate happened in 1972. We also had the Munich Olympics, which was marred by a terrorist attack. And it was also the year of the first known esports tournament. So the first known esports tournament was actually called the Intergalactic Space War Olympics, and it was actually held at Stanford University. So esports has a 53-year history now. So pretty long history that we're going to. In terms of how and what is played, there's several different platforms that you can play on. A lot of the gaming systems actually, are played on PCs, PlayStations, Xbox, Nintendo, others. And then there's multiple different types of games that are played. So League of Legends is probably the most popular esports game, which is a multiplayer online battle arena, or um, uh, uh, I want to say the MOBA for short. And then second category is Defense of the Ancients. 2 is the second game that's most often played. With multiplayer online battle arena games, they are trying to do is you'll have multiple players, usually in some teams of 5. So 5 players, and you're trying to beat the other players. And go try to advance in levels like that. First person shooter games, which was what I saw with the Overwatch League, examples include Counter-Strike, Call of Duty. There's also real-time strategy games such as StarCraft, Command and Conquer. And real-time strategy games, what the goal is for those sorts of games is for you and another player, another team are playing simultaneously and trying to defeat each other. So it's different from where you take turns going through strategies. So it's different than a chess match in terms of one player goes and then the next player goes. You're actually building up and strategically deciding what to do during the game to beat the other team. And then there's also sporting games such as Rocket League and Madden, which is with the NFL. To kind of put it in also perspective of where are these actually being played. The University of Akron actually has had multiple national championships in esports. And actually, from what I have found online, Ashland University in Ashland, Ohio, is actually one of the top universities for people who are interested in esports. In regards to ESPN, ESPN has taken a heart with the Collegiate Esports Championship. So there are definitely competitive gaming levels that are recognized and played on national networks. How do people interact? So we have ESPN for most sports. For gamers, we have Twitch. To put it in perspective, Twitch actually averages over 7 million active streaming channels per month. Viewers, these are 2025 statistics. Viewers have already watched more than 16 billion hours of content. Roughly 2.2 million viewers are watching Twitch at the same time on average, and around 93,700 channels are actively streaming live content. So if people say that people are not watching esports online, there's the statistics to prove it. I also want to put that these athletes are actually making a lot of money. So this is the top earnings for the esports athlete. The number one person you can see was they earned about $7.1 million. To put it in perspective, the average football player salary is about 2.7 million per year. Average baseball player salary is 4.66 million per year. The average basketball player salary is about $11.9 million per year. And to also put it in a different perspective, esports itself, so not looking at how much each individual player gets, is a $560 million industry. So with that, I want to say that back in 2022, I had the pleasure of presenting at the American Academy of Orthopedic Surgeons on esports. And I remember the focus of our lecture was actually a debate: is esports a sport or not a sport? And coming now from 2022, March of 2022, and going to March of 2025, sorry, October of 2025, we now have it to be an Olympic sport. So now in Saudi Arabia in 2027, esports will be one of the recognized sports that's played by the Olympic athletes. And with that, I do want to pass the baton off to Dr. Kenneth-Nwosa. Just to give background, he was actually, I was his mentor, not the other way around. So this is just a blast from the past, and I'm actually excited to be able to have him be my co-presenter and subsequently my next follower in presenting. So thank you guys so much.
Thank you, Dr. Bhardwaj, for your excellent presentation. It's my pleasure to introduce our next speaker, Dr. Ken.
Okay, so everybody, my name is Dr. Ken. I'm a professor, assistant professor at UT San Antonio, head team doc for Division I athletics at UTSA, also associate team doc for the San Antonio Spurs. I'm going to talk about the most common injuries we'll see in competitive video gaming and how to approach the esports athlete. So, I took the pleasure to provide some true gaming tags on it, so you know that I'm a true gamer. Here's my Twitch, my Xbox and PlayStation. If anybody wants to, join me in playing some video games. No disclosures. Most of my information came from the Handbook of Esports Medicine. It's a great textbook explaining the background of esports, also some clinical diagnoses and treatment plans for athletes, and also looks at not only the MSK side, but the mental aspect side, and also the environment around esports. So, like I said, I'm going to talk about common injuries, the diagnosis and treatment. As you should assume, most of the injuries are upper extremities. I'm also going to reach on neck and back, and also lower extremities. So my poison of choice is college football 26. Me and my old med school and collegiate, my med school undergrad buddies have an online dynasty in which we try to, one up each other on the recruiting trail. So it's always a good time. So for upper extremity, we'll talk about 5 main injuries that we can see in competitive gamers. Radial styloid tenosynovitis, proximal intersection syndrome, extensor carpi ulnaris tendinitis, medial neuropathy of the wrist, and also lateral epicondylitis. So the first injury, the first illness or inflammation that we see is called gamer's thumb. How relevant is that, right? Radial styloid tenosynovitis, also more commonly known as Quervain's tenosynovitis, is noticing pain in the radial wrist during thumb or wrist movements. I know there's medical students watching. You have done anatomy, right, since your MS1 years. And if you can try to remember which side is radial and which side's ulnar, you'll get a lot of these common diagnoses. So we're looking at the radial side, which is the radial styloid will interact with the scaphoid and the lunate. And essentially, we have the first compartment of the extensor tendons of the wrist, right? So that first compartment is on the radial side. So that's where the thumb is, right? And then we see all those, if we look at this anatomy, we see that can you guys see my mouse? Okay, so we have the radial artery, we have the flexor carpal radialis, we have the brachial radialis. So this right over here is the radial aspect of the wrist. And right over here is the most important part for the tenosynovitis. It's the styloid process of the radius, okay? So on the right, we can see that that first compartment and the anatomy that supports that first compartment, which is the APL and the EPB. For a common mnemonic that you'll learn is all peanut lovers eat peanut butter, right? So that's the first compartment. And it is the inflammation of that first compartment that will cause the discomfort around that radial aspect of the wrist. So, like I talked about, hopefully you remember, if you leave this lecture learning something, at least learn all peanut lovers eat peanut butter. Okay, that's your first compartment. So what that does is that it moves the thumb away into abduction and extension. Okay, so you're making that kind of L shape. Okay, and that's what the sheet will cross the extensor retinaculum and the radial styloid, and it's moving back and forth. As we could assume, and with competitive gamers, you're not getting acute trauma. Most of these injuries are repetitive trauma and they're overuse, which leads to shear force issues that will result in inflammation and degeneration of the specific body part that's in discomfort or in pain. So specifically for this first compartment, we can actually see this picture right over here, and it shows the extensor pollicis brevis and the abductor pollicis longus, and there's a lot of fluid around that. So that fluid is an example of inflammation. So an ultrasound diagnostic image can definitely provide you more information about if there's inflammation within that first compartment. The patient could complain about, his pain worsening with rotation, gripping, using the analog stick. And also he's noticing weakness with grip, and the onset could be gradual. And we most likely see this distal and lateral to the radial styloid. That's important to understand, and you'll see why later. Common test that we can do for physical exam is called the Finkelstein's test. Essentially, you have them place their thumb into their fist, and you basically passively ulnar deviate that wrist, right? So remember radial and ulnar, so ulnar towards the pinky side, and you radially and you ulnarly deviate that wrist, okay? And it's gonna hurt. It's gonna cause a lot of inflammation and discomfort. It's gonna cause a flare-up of pain. But it's important to understand that this test isn't very specific because a lot of people don't stretch out this muscle. So if you probably do it to yourself right now, you're like, oh, actually that hurts. Do I have gamer stuff? Oh, you probably don't. It's just you just haven't worked out that muscle or stretched out that those tendons out. Okay. All right. So the diagnosis, like what I talked about, ultrasound is great to look at thickened tendons and tendon sheath inflammation. For treatment, consider immobilization. A thumb spica splint can be effective. There's some debate around that. Activity modification. So if they have an analog stick, consider getting a customized controller to have a shorter analog stick, and maybe they need to modify the keyboard or keybinds that they have. Physical therapy can be important to work on wrist range of motion and also work on tendon loading. And also anti-inflammatories could decrease inflammation in the short term. And then you can consider corticosteroid injections, which can have a 50% rate. So a lot, we talked about gamers some. We can also see this in individuals and ladies that recently had babies. We see this, it's also known as mommy's thumb. So this is a very common inflammation, very common side of inflammation. And there's different types of treatments that we can try, even up to including surgical release of the first compartment. Another type of overuse injury into the wrist is called proximal intersection syndrome. And this is often misdiagnosed as radiostyloid tenosynovitis. So I talked about how the gamer's thumb is more distal and lateral to the radial styloid. This one we see more dorsal and dorsal and proximal in terms of the site of pain in relation to the radial styloid. So what happens is that the first compartment, which we talked about, all peanut lovers eat peanut butter, right? The first compartment crosses over the second compartment, and the second compartment holds the extensor carpi radialis longus and the extensor carpi radialis brevis, and it's usually about 4 centimeters from Lister's tubercle. The yellow area, the little yellow arrow that you see is that intersection, right, between that first and second compartment, and that's the area where we get most concerned about inflammation and pain. So again, repetitive overuse while the hand is gripped leads to inflammation. The pain is proximal and dorsal, and you typically have tenderness and palpation over this intersection area. A good way to another good way to differentiate between gamer's thumb is that with the proximal intersection syndrome, you actually see or you actually can feel or even hear crepitus with wrist and thumb extension. So again, treatment is including rest and recovery, working on activity modification, and conducting specific exercises. So we can possibly see this in PC gamers in which the keyboard hand is affected by the height and the wrist angle while gaming. In terms of pathology and anatomy of the next one, which is extensor carpi ulnaris tendinitis, this happens in the posterior compartment of the forearm. Essentially, the ECU attaches to the base of the fifth metacarpal, so that you're basically your pinky finger, and it has a separate subsheath. So most extensors, like when we talked about the extensor carpi radialis brevis and longus, they are usually under this extensor retinaculum. So it doesn't have any type of ulnar component. And because of that, they're not really affected by your pinky or different types of wrist movement. This ECU is, right? So the ECU is like a lone wolf from the extensor retinaculum. So when the wrist supinates, the ECU bends at the subsheath and it reaches an angle of 30 degrees. Okay, so you can just imagine if you have a tendon that's kind of bending and going at different angles, over time, you most likely will develop some type of inflammation, chronic degeneration in that area. So the presentation is that you'll see a gamer that has pain with dorsiflexion and rotation of the wrist. An esports athlete will have a non-neutral keyboard wrist positioning, maybe more in the dorsiflexion position. If they're a PC gamer and they have flick shots with the mouse, there could be rapid wrist adduction, and you're going to notice that dorsal ulnar-sided wrist pain. So diagnosis, there could be some swelling, some tenderness and palpation over that ulnar aspect, pain with active wrist extension and ulnar deviation. And there's something called the ECU synergy test. It's kind of hard to explain, and when you read it, I can't really compute it when I read it. I have to watch a video to understand. But essentially, you have the patient rest their arm on the exam table with their elbow at 90 degrees and the wrist is in neutral. You're going to hold their index finger and thumb, and then they're essentially going to abduct their thumb against resistance. And if there's pain on that ulnar side where that ECU is located, then that is essentially a positive test, and you can conclude with your other diagnostic measures and subjective HPI that the patient has ECU tendinitis. So this is kind of an example of what I'm talking about on the right. They are grabbing that index and middle finger, and they're kind of cupping the thumb. So the thumb is actively abducting, and you can see that ECU being being activated right there. And if they are describing a lot of discomfort and pain, then your suspicion can definitely raise. And then on the left, you can see exactly what we're talking about when the wrist is in rotation. Is that subsheath with the ECU lone wolf tendon, when you move it, it goes into an angle, that 30-degree angle. So that continued movement with either the flick of the mouse or the dorsiflex wrist position with your keyboard, that can definitely cause some further inflammation and flare-ups. Median neuropathy of the wrist, also known as carpal tunnel syndrome. Just as an example of the median nerve and its distribution. Essentially, there's a motor nerve, there's a motor component and a sensory component of your median nerve, and the areas in green is the area that the sensory portion covers, which is the thumb, first finger, second finger, and the radial aspect of that ring finger. What happens is that as the carpal tunnel, as the median nerves travels through that carpal tunnel underneath that flexor retinaculum and transverse carpal ligament, due to overuse or chronic inflammation, the tendons can thicken and there can be some swelling in the area. And the tendons aren't going to change. The tendons aren't going to be compromised, but the nerve will be. So the nerve is going to be compromised, it's going to be squished, it's going to be angry. And what is that going to cause? It's going to cause a lot of numbness and tingling and even lead to weakness down the line. So like I talked about carpal tunnel, the compression of the median nerve as it enters the hand through the transverse carpal ligament and flexor retinaculum. The sensory aspect, the motor aspect, for those who need a great acronym, LOAF, for the motors, lumbricals, flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis. It helps with thumb flexion and abduction. So like I talked about, the presentation is normally numbness and tingling in the sensory distribution. Weakness is a red flag for long-standing and chronic compression and injury. And another concern would be the thenar eminence, right, which is kind of like this muscular fat pad right below your thumb. That MCP joint of your thumb is kind of that padding right there. If you start to see atrophy there, that again is showing that the motor nerve is compromised, that muscle is not getting activated, and it's atrophying over time. Special test is phalanx maneuver, which is like if you do the prayer hands emoji and you just kind of flip it around and do it upside down, where both your wrists are flexed, okay, and you hold it together for at least 60 seconds or so, and they start to feel numbness and tingling in that sensory distribution. You know, that's a positive test. A carpal compression test, where you push down over the flexor retinaculum and the carpal tunnel, and you just kind of really push down and compress that area. And there's numbness and tingling in that sensory distribution. Again, you're concerned about that. Tinel sign, you're tapping that area. If there's a radiating, shooting discomfort or sensation of tingling or numbness, that again is a positive for carpal tunnel syndrome. Another way you can further investigate carpal tunnel syndrome is a nerve conduction test along with the EMG. Treatment, pretty basic. If you know, it's the same kind of treatment. It's pretty much relaxed, right? So nocturnal wrist splinting, doing therapy, working on range of motion and strength of your hand and wrist. You can consider some gabapentin for neuropathic pain, and also consider an ultrasound-guided corticosteroid injection to decrease the amount of inflammation and possibly provide some kind of hydrodissection around the median nerve. And this is a fairly common surgical indication for chronic issues of your carpal tunnel. So this is a pretty common surgery that our hand specialists perform. So keeping with the upper extremity, we'll go a little bit higher up into the lateral epicondyle of the elbow, and that's why it's named lateral epicondylitis. So this is also known as tennis elbow. So the lateral epicondyle is a bony origin for the majority of the wrist extensor. We talked about the ECRB and also the EDC. So this isn't an acute inflammatory reaction like the others, like the other ones that we've talked about. It continues to be a chronic overuse issue. So chronic repetitive eccentric motion leads to tissue injury. There's pain over that lateral epicondyle, that little bony prominence. You can kind of feel that area right now, and just that little bony prominence on the outside of your elbow. And you can see that the gamers will have pain with resisted wrist extension, resisted third digit or middle finger extension, pain with resisted third digit extension, and also resisted pronation and supination will cause pain. So there is a kind of a cartoon of the extensor muscles and the attachment along the lateral epicondyle. Some different types of treatments for it. Of course, you want to calm it down with NSAIDs for the short term, ice. Some can prefer heat. You can also consider bracing, like a counterforce elbow brace that will decrease the amount of tensile force onto the lateral epicondyle and the injured aspect of the tendon. Again, physical therapy, working on range of motion and strength of your elbow, your forearm, your wrist, and your hand is very important. And then also for refractory cases, you can consider injection of the area. Some can attest to a steroid injection around the area, being able to provide relief. There are several studies that PRP is also effective while undergoing a PEP ring to promote healing and the pro-inflammatory healing process. So that's something to consider. I put this because essentially most of this issues, if you can just stop playing a little bit and just touch grass, I think you'll be fine. I think you can avoid most of these upper extremity problems. However, for individuals that are trying to put in work and be professional, that may not be an option. You may have to put in several hours a day, but you have to be able to know when to take a pause and stretch out these areas, including your wrist, your elbow. You got to be able to, press pause, press the start button once in a while. Okay, so neck and back, it's all about posture. Okay. The forward head posture, aka nerd neck or eye hunch, it's a pattern of upper thoracic and lower vertical flexion with upper cervical and occipital extension. So this isn't necessarily pathology, but it could definitely lead towards that. It develops as a consequence of combined muscular weakness, tightness, and abnormal spinal mobility. Essentially, when we look at that line of gravity from the right, we want all these things to kind of line up as shown. And unfortunately, when you have that forward head posture, everything becomes off, and you can have increased pain and fatigue of neck and back muscles, decreased head and neck movements, jaw pain and inflammation, and also upper back and scapular pain. So you want to do an ergonomic assessment of the gaming space. Are they using a gaming chair? What's their setup with their keyboard, their mouse? Is the desk high enough? How close are they from the screen? How high is the screen? How low is the screen? Do they have a multi-screen setup? So that's the assessment part. Then there's a multifactorial approach to strengthen the muscles, consider myofascial releases, work on thoracic and cervical exercises and joint mobilization, and again, fix that workspace and posture. For the lower extremity, one of the things we for gamers who could be sitting in their gaming chair all day, we get worried about deep vein thrombosis, which is damage to the intimal lining of the veins in the lower extremity, which will then cause decreased blood flow and blood clots, which can eventually lead to pulmonary embolism. So it's correlated with periods of prolonged immobility, which is normally due to debility or post-surgical states, normally, but gamers are at an elevated risk when subject to prolonged gaming sessions. So when we talk about the creator of StarCraft, Jeff Robinson, he had a deep vein thrombosis prior to developing a pulmonary embolism, in which he eventually passed from. So this is something that's serious, something to be aware about. And again, we have to be able to promote and educate about moving, educate about taking breaks and walking around and getting normal exercise for your lower extremity. So the most common veins are femoral, popliteal, posterior tibial, peroneal veins, increase the risk of smoking, long air travel, blood clotting disorders, and obesity. The biggest thing also is dehydration. Promoting hydration while gaming is very important, and it's important to have a hydration plan if you plan on logging in several hours of gaming. So unilateral is more common. You can also see symptoms of fatigue, pain, pressure, redness, inflammation, warmth near the site of thrombosis, and coolness distal to the thrombosis location. So the symptoms that you want to watch out for PE signs: shortness of breath, increased heart rate, chest pain, spitting of blood, dizziness, fainting. Diagnoses: there's something called the Wells criteria, in which you can go to MD Calc and input information, looking at a D dimer, ultrasound, color Doppler imaging, and the gold standard is the contrast sonography. So prevention: take breaks and touch grass, move around, get the blood pumping in your lower extremities. Treatment is usually via oral or IV anticoagulants or thrombolytics, and for gaming, return to play is immediate because there's no contact. All right, so I have finished sharing, so let me take this off.
Thank you, Dr. Ken, for the excellent presentation. And as Dr. Ken mentioned earlier, he is the head team physician for UTSA and their NCAA Divisions I athletic program. He serves as the chief medical officer for the athletic trainer residency. He's also the team physician for Brandeis High School, the minor league baseball team San Antonio Missions, and a consulting physician for the NBA's San Antonio Spurs. He is an active member of the American Medical Society for Sports Medicine and has presented at their national meetings. He is also active in publishing peer-reviewed articles and newsletters pertaining to the growing scope of sports medicine and non-surgical orthopedics. Thank you again, Dr. Ken, for your excellent presentation. And now it's my pleasure to introduce our last speaker, Dr. Dominic King. Dr. Dominic King is an interventional sports medicine physician at the Cleveland Clinic. He specializes in minimally invasive musculoskeletal procedures and orthobiologic treatments. He directs the Esports medicine program, caring for neurocognitive athletes alongside traditional athletes. He is the Enterprise Medical Director of Clinical Access and Virtual Health Services. As a clinical informatics specialist, he has extensive experience leading efforts in intelligence automation and agentic AI to advance decision support and improve patient access to care. He is a graduate of the West Virginia School of Osteopathic Medicine with residency and fellowship training at the Cleveland Clinic. And Dr. King, you are now welcome to begin your presentation.
All right. Well, thank you, Milan. Good evening, everyone. Pleasure to be invited to speak to you all tonight. I'd like to thank Dr. Ken, or Kenny Two Shoes, as he made us aware on the title slide of his talk. Thanks for providing a really very, very comprehensive and valuable overview of the injury these esports athletes are exposed to. I think that's probably the best collection that I've seen so far, end to end, outlining those exposures. And thank you, Namita, for starting us off by setting the stage, reviewing what esports actually is. And Namita, thank you for calling out the esports powerhouse that exists at the University of Akron. That is my alma mater, if any of you are interested. So with that framing that Namita provided, I'd like to kind of take the next step for those of you watching this and thinking, wow, this is all really cool. I'm sure there are so many elements of esports you could talk about. Where does esports, though, fit in when we consider the current and the future landscapes of the rest of traditional sports and traditional sports medicine? Well, this part of the video is for you. So when I think about where our field is heading, I believe we're entering an era that's going to be defined by something that I call athletic performance intelligence. So what do I mean by that? It's the ability to really understand and integrate everything that makes an athlete perform. So not just their strength or their speed or their endurance, but how they think, how they react, how they decide, how they adapt in real time. It's how we measure and train those systems, but really importantly, how we translate that understanding into better health, better wellness, better capability, better performance for athletes. That's athletic performance intelligence. And to understand why that matters and what that has to do with esports, let's start with something simple. So every sport has its equipment. You have the balls, the gloves, the bats. But there's one piece of equipment that every athlete brings to every practice, every game, every competition. It weighs about 3 pounds. It contains over 86 billion neurons, and it connects more than 100 trillion synapses. It is the most sophisticated piece of sporting equipment ever made. And that's the human brain, right? And our future lies in learning how to leverage this piece of equipment to build athletic performance intelligence. So I want you to think of this as upgrading the mind-body operating system. So through research, through innovation, we've come to really understand an athlete's body, but our understanding of how an athlete processes information, how they make decisions, how they adapt, in ways that's still running on an older operating system. So as Wayne Gretzky famously said, which I'm sure all of you are familiar with this, skate to where the puck is going to be, not to where it's been. And with technology and where we are in 2025, we're reaching the point where we can see where the puck's going and we can begin to upgrade our approach to human performance. And interestingly, one of the populations that's helping us understand that system better than anyone else are esports athletes. So at Cleveland Clinic, we have an esports medicine program, and we're studying and caring for a population of athletes who train and compete entirely with their minds, right? Their sport is cognition. Their muscles are their neural pathways. And what they are teaching us about focus, about fatigue, and mental agility has enormous impacts for every athlete, not just esports athletes, but every athlete in every sport. So our program combines clinical care, research, and education. And I'm honored that on the call tonight, we also have Jason Cruikshank, who's an athletic trainer, strength and conditioning specialist, and a neurocognitive aficionado, and someone who helped build this program with me. The program provides care for professional and collegiate esports athletes. We partner with different esports teams and leagues. We've collaborated on performance and mental health strategies. And we've published on these approaches. We've trained medical providers. We even created what's called the Gamer's Health Guide that you can scan there and take a look at, about a 40-page document that we put together that addresses many of the issues that Dr. Ken spoke about. How do we prevent some of those? What does a stretch and strengthening protocol look like for an esports athlete? And just this week, we submitted a revision for our chapter in the upcoming edition of Netter Sports Medicine. It's the very last chapter, so it's not hard to find. You just flip all the way to the back of the book, section 101, and it's right there. In regards to research, when we compared esports athletes to age and gendered matched NCAA competitors, we found something really remarkable. So we used our C3 logic system and found statistically significant higher baseline neurocognitive and psychomotor scores, faster reaction times, higher processing speed, greater accuracy across multiple domains. And we use that to give the moniker of synaptic specialist to these esports athletes. These are true neurocognitive athletes. And it's with that understanding that really starts to challenge our entire definition of what it means to even be an athlete. So let's look at what that looks like in action for an esports athlete. So on the left, you're going to have Kyle Booga Giersdorf. So he is a Fortnite world champion. And I want you to watch how his hands, his eyes, his brain, they all operate in this closed loop system, right? So he's scanning, he's building, he's switching, he's tracking. He gets hundreds of these little micro decisions per minute. At the same time, on the right is Faker. So Faker is one of the greatest League of Legends players of all time, and League of Legends is considered to be one of the most cognitively demanding esports that's out there. So if you look at what he's doing, he's managing different teammates, he's managing enemies, cooldowns, terrain, constantly processing just a flood of visual and auditory information all at the time. So he turns all this chaos into control. None of this is video lag that you're seeing. None of this is at double speed. This is all real time. These esports athletes, these synaptic specialists, operate at a cognitive speed that people can't even try to visually follow for most of these competitions. And what's amazing is behind every flick of the mouse for them, every click, every keystroke, are thousands of little synaptic transmissions per second. And those are the same neural systems that drive anticipation, reaction, execution, not just in this, but any sport. But what we're watching here is pure neurocognitive athleticism, if you will. Let's take a little closer look at how this plays out into the most competitive esports environments that are out there. So League of Legends and Valorant. In League, if we start with like a top lane position, so this is one of the positions in the game, and we just look at the gameplay skills, these for top lane revolve mostly around like map awareness. So split pushing, one-on-one combat, a lot of lingo that's true to League. It's about holding space, making quick, high-stakes decisions. In Valorant, the parallel role for this would be like the duelist. So they have a very aggressive playmaker that's responsible for precision aiming, execution, reaction time, and resource management. So for the gameplay skill, that's what everyone can look at and observe. What we're doing is layering on the neurocognitive and psychomotor domains. And then we start to really see the underlying systems that define and drive excellence for these athletes. So for that League top laner, that includes neurocognitive skills like decision making and strategic planning, situational awareness. And those are supported by the psychomotor skills like precision in execution or their reaction time. And for Valorant, that neurocognitive layer is adaptability, decision-making, spatial awareness, very different than just the gameplay skills. And when we broaden this scope beyond these just roles, the richness really starts to emerge. So in League, every position has a unique fingerprint of cognitive and motor demand. So the junglers balance strategic planning and timing. Mid laners rely mainly on spatial mapping and rapid reaction under pressure, so on and so on with each one of these positions. And in Valorant, you have these different agent classes. So you have duelists, initiators, sentinels, controllers. These all map to distinct mental and motor challenges. So duelists prioritize precision and speed. Initiators are people who focus more on timing and coordination. And across both of these games, we see how every tactical layer, from decision-making to mechanical execution, all of those, because they're on their platform, in-game can be quantified, they can be analyzed, and they can be trained. And this is the bridge between esports and traditional sports. Imagine being able to measure this kind of precision, those milliseconds of perception, reaction, and decision across every athlete and every sport. And that's exactly where the industry is heading. So across performance, medicine, and technology, we're seeing an explosion of different tools. And those tools can capture and train these systems. So we have tools for reaction and decision training. We have tools for sensory and visual processing, tools and assessments for cognitive and psychomotor control, different systems for neurophysiology and biofeedback, and even different immersive cognitive training that uses AR or VR. Each of them are brilliant, very cool. You've probably heard of many of these or seen them or have used them yourselves. The thing about it is all of these generate just mountains of data, but they're all speaking different languages. And what we're seeing is that the real problem isn't data collection for our athletes, it's the data connection. It's bringing all of this together to make sense of it. And that's where athletic performance intelligence can come in for us in the future. It can act as that connective tissue layer that translates the data that we're acquiring into value for the athletes. We don't need more numbers. We're just going to get flooded as sports medicine providers more and more in the next coming years with more data and more numbers. What we need is to move around this circle from data to information, information to knowledge, and knowledge to wisdom. Think about what it would be like to have all this data, all the physical, neurocognitive, psychomotor assessments, all of it, not in a silo, but speaking to each other when a player is in a video game, or if a soccer player is actually on the field. So one day you, as the sports medicine physician, may have a tool that actually connects all of this: in-game performance, neurocognitive metrics, psychomotor data into one system. So I want you to imagine that you're out of these screens and going to touch grass, as Dr. Ken would say, right? And let's imagine for a second caring for a soccer midfielder. So in this new kind of world where we have one intelligent system. So the soccer midfielder training data tracks acceleration, heart rate variability, reaction speed. And during a match, the system detects a slight delay in his peripheral vision and decision making. It links that to elevated cognitive load, more eye movement, poor recovery, poor sleep for the last 2 nights. And before the athlete even starts to feel off, the system flags it and says to you, to the trainer, there's early cognitive fatigue detected. And it gives you the suggestion that tomorrow we should reduce the overall load. We should add some targeted recovery. We should incorporate vision and decision speed drills. That's athletic performance intelligence. So we are closer to that than we've ever thought. And esports athletes are the group that's helping us understand this. So this is a future where we don't just respond to injuries, but we anticipate dysfunction and optimize readiness. And what's really cool, that future scenario is going to become a reality sooner than any of us think, because I'm proud to share that we're bringing that kind of thinking into a physical home through what we're calling a global peak performance center. So this is a building that's set to open in 2027, and it's not just a training facility. We have over 210,000 square feet of interdisciplinary performance space that's designed from the ground up to serve athletes really at all levels. So we'll have sports medicine docs, exercise physiologists, neurologists, nutrition, genetics, all tied together by what we're calling a performance intelligence framework. So if you haven't heard about this, please look it up. It'll be really a dedicated environment where we can test, we can train, we can monitor, we can optimize human performance that bridges sports, medicine, and technology all together. So we're going to have an esports space that will be in this building, and really using that gamification and really understanding of neurocognitive and psychomotor performance, not only to help esports athletes, but really to help every athlete and anybody who walks through that building. So in closing, I'll leave you with this. One, the brain is the next piece of equipment, right? Every athlete trains their body. Very few truly train their brain. And understanding and optimizing cognitive load is the next frontier of athletic development and rehabilitation. If you want to know what that looks like, go watch an esports athlete train and compete. Number two, connection beats collection every single day. We don't need more data. We need more connected intelligence. And number three, athletic performance intelligence is being built. We're building it at the Global Peak Performance Center. Really a place where sports medicine, technology, neuroscience can converge and define how human performance will be measured, how it'll be trained, and how it'll be elevated. So thank you guys for your time.
Thank you so much, Dr. King, for your amazing presentation. Now we'll begin our Q&A segment with our speakers, but I once again want to thank all of our speakers on the panel today for the informative presentations on esports gaming. And I'd like to invite everyone that's attending today to please type in any questions you may have in the chat, and I will read them out to our audience. While you gather your questions, I do have a question myself that I would like to ask the panel. So like, when were you all first exposed to esports medicine? Was it something you were aware of before you entered medical school, before residency, before fellowship? Kind of where was your first introduction? And was it something you guys knew you wanted to be a part of in the long run?
I was definitely exposed later in life as someone who played video games as a kid. I did not know that this field existed. I remember when Dr. Ken was a resident, we had talked about some of this stuff and how there's this professional development of esports. So I actually got exposed to it later in life as a faculty and just have seen it explode since then.
Yeah, I think a lot of the esports games came out when I was in high school and undergrad, and had a bunch of friends that played it, and they had LAN parties and all this stuff that that kind of in hot steamy rooms for some reason. There's no air conditioned. Like, why isn't the window open? Like, come on. But I've been exposed to that. I've been exposed to, like, especially from my sector is more of the sports games, right? So like Madden, NCAA, NBA, 2K, and there were always Madden competitions throughout the year, every year. There was a NBA 2K league, and that was kind of my get away from studying during undergrad and med school. It's just being able to participate in these competitions and play with some friends. And I had the opportunity to talk with Dr. Bhardwaj about this. And once we saw like things were bubbling up back when I was in residency, and to kind of see how it's now expanding and it's pretty much a world game. It's pretty awesome. It's pretty awesome to witness.
Yeah, and I think as maybe like the elder statesman on the call that's here, just in saying that too, it's funny because our fellows stay the same age almost every year, right? But we get a year older, and that just keeps happening after a decade and then more so. I don't know, I played. I remember playing a lot of Counter-Strike growing up, and there was some good competitive leagues that were there, but you kind of had to find them, right? As Ken said, to find like a LAN party. But it was probably about 2018, 2019 when University of Akron had said they're going to have their own varsity program for that. And I saw it come through, I think, on Twitter. And I texted Jason Cruikshank, who's on, and I was like, dude, esports, sports medicine, esports medicine. This makes sense. Let's do this. No one else is doing this. It's not competitive at all. We can be some of the first that are in there. And then we learned about Holly's Weibel and NYIT and the teams that were also looking at it. So like in those early days of saying, hey, if you take care of traditional sports athletes, apply that same approach to health, wellness, and performance to esports athletes. They need it, right? They're there, they're competing, regardless if you call it a sport, if they're athletes or not. These are competitors who are really good at what they do, and somebody should be taking care of them. So awesome that AMSSM is leaning in on that and having a talk like this.
Thank you all for that answer. So we do have a question in the chat. It seems like we're looking greatly at the cognitive of esports. Do we know anything about the cross between E and traditional sports and how the two can potentially influence and or benefit each other?
Yeah, I mean, it's a great question, and it's really where as it can lean into like where the future of performance science is heading. So we used to think of traditional sports and esports as separate worlds, right? So you have this one physical world and one digital world, but in reality, they share a lot of the same performance architecture. You have sensory input, cognitive processing, motor output, right? So that doesn't matter if you are an elite soccer, basketball athletes. You take milliseconds in tracking things. You have to make decisions and then determine the outcome of a play. You have the exact same milliseconds that decide a match in League of Legends or Valorant. What's fascinating though is that esports allows us to quantify those systems with incredible precisions because those thousands of data points per second happen on their platform. So all those those mouse flicks, those keystrokes, those are all recorded. So because we can understand those athletes better, it starts to open up in your brain. What if we could do that for every athlete? What if we knew where they were looking? Like, why does Steph Curry shoot the way he does? Yeah, there's skill, there's practice. What is it about his neurocognitive and psychomotor performance that allows us to say, if only you could do X, Y, Z, you'd be 20% closer to doing what he does. We're getting to that point, and I think that's where things are going to cross over between.
Awesome. So if there's no other answers, we can move on to the next question here. So what have you heard about the integration of virtual reality games into esports competitions?
I'm assuming like that means like like augmented reality, virtual reality games. I haven't heard anything about VR games coming into esports competitions, mainly because there isn't much of a good product out there. Most esports is about 1v1, 5v5, what we call PvP, and there aren't a lot of virtual reality games that can support that and create a competitive environment where people would actually want to enjoy and watch. So personally, I don't know if anybody else, but personally, I haven't heard of any type of virtual reality games.
There's a couple prototype VR leagues that are out there that are looking at games like Echo Arena or Beat Saber, but all of the reasons that Dr. Ken just outlined of why it's difficult to translate in there. I don't think the metaverse is everything that Facebook thought it was going to be after they just changed their name to Meta. I think it's been a little bit of a flop. But you are seeing, I mean, we have MetaQuest 3. We'll jump on, we'll go into different worlds and do things like that. It's fun socially, but to put that on a competitive platform, a lot more to jump through. So I think we'll see computers, be the main way that people are going to interact, keyboards, mouse.
Awesome. Thank you all for the answers. And we're going to move on to the last question here. What are the implications for the recreational esports athlete? Do you see many gamers in your practice?
Yeah, I mean, most of the people that I see it's somebody who's like, "Oh, you like to game? Go over and see this guy or this gal who wants to, see gamers." And I think it's fun because two things. One, it really does provide a place of validity. I think for an otherwise kind of marginalized group that goes, "Yeah, I'm an athlete. I'm a varsity athlete. My entire college is paid for, but nobody treats me like an athlete." I mean, it's a good point for that, but it's also a lot of fun because nobody's really competing with those athletes over you, right? So you get to like show them, do like an ergonomic assessment, have them sit in a chair. It's really cool because you can try to write off some cool gaming equipment too, and have it in your office, so you can get a bunch of controllers and those types of things. But yeah, I mean, I think just about everybody plays something. Probably everybody on this call plays something. It doesn't matter if it's on your phone and it's Wordle or Minute Cryptic, all the way to NBA 2K. I mean, we all play games. It's just, are you playing enough that it's becoming something that's either bothersome physically or mentally?
Yeah, same here. Or actually, no, not same here. I don't really see a lot of gamers in my practice. I take care of the UTSA, athletes and local high school athletes, but there are some sectors of some collegiate gamers that are in town. Maybe they don't feel comfortable enough or don't know where to go. So the idea, like what Dr. King is bringing up about understanding esports medicine, and if they see that there's a sports medicine position and available in their area, hopefully they'll feel inclined to seek us out, so we can understand the different MSK issues, the different types of problems that they could possibly go through doing their competitive gaming or even recreational gaming. So I hope that this talk, when they search on YouTube for, hey, my hand hurts and why, and they look up esports medicine, that this talk comes up and that they'll look to us as sports medicine physicians as a opportunity to be seen and be heard and be treated properly.
And just in addition to that last question, has there been any crossover with performance athletes like musicians?
So I'll kind of chime in on that one. Looking at performance at like musicians as athletes is a newer concept in the sports medicine world. Typically we weren't looking at it like that angle. So I think they are probably a little bit behind what esports is. And eventually I can see like Dr. King Center expanding. I'm giving him more tasks to do, but expanding to include how that would factor in. But it's definitely looking at musicians as performance athletes is a newer side of sports medicine. So esports used to be much newer. Now it's a little bit more like an adolescent, teenager type years, and this is more in like infancy and stuff like that. So I definitely see it developing. As far as any specific literature out there, I would not be able to say, but I think it's definitely future potential growth area.
Two takeaways from that. When you talk about neurocognitive skill, musicians are athletes of timing and precision, right? So their training just happens to occur through sound rather than through motion. And 100% of what Namita just said makes sense, right? If you can perform at a certain level, you can train, you can understand that, you can analyze it, you can actually outline what does excellence look like, and then how do you train that better. Number two, there's a lot of injuries that you'll see musicians get and athletes in the arts that will get when you get into dance and all of the, again, timing and precision. For any of you that are out there, as you go to become a sports medicine physician, go take care of orchestras. The reason for that is you can have them all bring their instruments into the office and have them play. And it's the coolest thing that when everyone else is, seeing people who are coming in and you got, your different athletes, you're not bringing a pickleballer in and you're going to be like getting into the kitchen in your office, but you can have somebody pop open a cello and just say, I just want to see what you do day to day. And you already know what they do, but you get to like have a little mini concert in your office with it. But it's they love it because they actually show you and you get a better understanding. Ken could probably come up with an entire presentation just all on like violinist injuries, and you could like break down why they have a little bit more overuse of their right hand and like what vibrato does to the tuft of your finger. So that's a great question.
Awesome. So before we conclude tonight's webinar, I want to express our gratitude to tonight's speakers. It has been an honor to have Dr. Namita Bhardwaj, Dr. Ken, and Dr. Dominic King serve on our speaker panel. Your presentations were excellent and impactful for residents and medical students to learn more about esports medicine. I also want to thank everyone here for attending tonight's webinar. So looking ahead to November, I want to invite you to join us for our next MSIG webinar, Adaptive Sports USOPC, which is the first webinar of a two-part series that will be held on Friday, November 14th at 4 p.m. Eastern Time, where we're featuring Dr. Cherry Lawat, Dr. Victoria Hesley, and Dr. Carrie Jaworski on the speaker panel. The deadline for resident and student members to submit their SMRC or MSIG officer nominations is quickly approaching. The deadline is Monday, November 3rd. To submit your officer nomination. I want to encourage all resident and student members to consider nominating themselves as a candidate for the upcoming election of SMRC officers and MSIG officers for the 2026 calendar year. The election of officers will be held over a 2-week period in November, and all resident members are eligible and encouraged to vote in the election of SMRC officers, and all student members are eligible and encouraged to vote in the MSIG officer election. It has been my pleasure to serve as tonight's webinar moderator. This concludes tonight's webinar.